The World Health Organization has declared the latest Ebola outbreak in the Democratic Republic of Congo a public health emergency of international concern, its second highest global alert level after the virus killed nearly 90 people and spread beyond Congo's borders into neighboring Uganda. While the WHO has stopped short of calling it a pandemic emergency, officials warn this could become a far larger outbreak than currently detected, with serious risks of regional spread across Central and East Africa. Hello and welcome to The Print. I am Samah Qundeel and here's what happened. The outbreak is centered in Congo's eastern Ituri province, a region already battered by armed conflict, mass displacement, and weak healthcare infrastructure. Health authorities have recorded hundreds of suspected infections and dozens of deaths, with confirmed cases spread across Bunia, Mongwalu, and Rwampara. Alarmingly, one confirmed case has also reached Kinshasa, Congo's capital, after an infected patient traveled from Ituri, raising fears that the virus has already moved far beyond the original hotspot. Cases have now crossed international borders. Uganda has confirmed 2 Ebola infections linked to the travelers from Congo, including one death in Kampala. Rwanda has tightened border screening, while regional governments are strengthening surveillance systems to prepare for possible spillover. The WHO has urged neighboring countries to activate emergency operation centers and intensify contact tracing before the outbreak spreads further. What makes this outbreak especially worrying is the virus strain involved. This is not the more familiar Zaire strain of Ebola, for which vaccines and targeted treatments exist. Instead, it is the rare Bundabijo strain, first identified in Uganda in 2007, which has no approved vaccine and no specific drug treatment. Previous Bundabijo outbreaks killed around 30 to 50% of infected patients, making it one of the deadliest known Ebola variants. Ebola is a severe viral disease that spreads through direct contact with infected bodily fluids, such as blood, vomit, sweat, and contaminated surfaces. It does not spread through the air like COVID-19. Symptoms typically appear between 2 to 21 days after infection and begin suddenly with fever, headache, fatigue, and muscle pain. As the disease progresses, patients can suffer vomiting, diarrhea, organ failure, and in some cases, internal and external bleeding. Health officials say the first known case in this outbreak was a nurse who developed symptoms in April, but confirmation took weeks because initial tests failed to identify the Bundibijo strain. That delay allowed transmission to continue undetected for several weeks, giving the virus time to spread across health zones and into densely populated urban centers. Experts warn this means health authorities are already behind where they would ideally be in controlling the outbreak. The challenge is compounded by insecurity in eastern Congo, where armed rebel groups continue to operate. Ongoing violence makes it difficult for health workers to reach affected communities, trace contacts, and safely isolate patients. The region's mining economy also creates constant movement of people between towns and across borders, increasing the risk of wider transmission. Another major concern is burial practices. During past Ebola outbreaks, traditional funeral rituals involving washing and handling the bodies of the dead became major sources of infection. Because Ebola remains highly contagious after death, health authorities are urging families to follow safe burial guidelines to prevent further spread. The WHO has advised against border closures or trade restrictions, saying such measures are often driven by fear rather than science and can push people into informal crossings that are harder to monitor. Instead, officials are focusing on isolation, testing, contact tracing, and public awareness campaigns to stop transmission chains. Congo has dealt with at least 17 Ebola outbreaks since the virus was first identified there in 1976, giving its health system significant experience in responding to such crises. But experts say this outbreak presents unusual challenges because of the lack of vaccines, the delayed detection, and the unstable security situation in the affected area. For now, the risk of a global pandemic remains low. Even during the devastating 2014 to 2016 West Africa outbreak, which infected more than 28,000 people, international spread remained limited. But the WHO's emergency declaration is a clear warning that the coming days will be critical. Thank you for watching. For more such updates, keep following The Print.